Hi all. Today I am going to talk something about ultrasonography. This is the basic information for the undergraduate students. What is ultrasonography? Ultrasonography or USG, that is a short form of ultrasonography, or we generally call it as ultrasound scanning. It is a non-invasive imaging technique using high-frequency sound waves. What do you mean by non-invasive? Because it is not causing any problems to the body. It is not an invasive thing. So just by using high frequency sound waves, just like how bats are flying, the same way, the waves which we cannot hear otherwise. So high frequency waves are used to image the body parts. Principle of ultrasonography. There is high frequency sound is directed into the tissue by a material called transducer. The sound wave echoes and reflects back. The reflected back signal is again captured by the same transducer and made it into an image by the help of a computer. So computer is giving us the final result through its screen, and what provides matter to computer is the transducer. Advantages of ultrasonography. Definitely, there is no ionizing radiation used. What does it mean? When there is no ionizing radiation, almost no side effects, no known harmful effects for ultrasonography. So it is the best imaging technique during the pregnancy period to find out the growth of the fetus, because fetus is not at all affected by this technique. Excellent image of the soft tissues. Forget about hard tissues, we cannot see anything, but soft tissue imaging is best with ultrasonography. Real-time imaging, the moment you scan, immediately the same time you can see it in the computer monitor, what is happening. Inexpensive and widely available. Everywhere it is available, every center it is present. Disadvantages, it is not used for bone lesions because our sound wave cannot penetrate bone and image the limited penetrative depth. So very deep lesions, which is very difficult to get ultrasonographic image, where it is soft, superficial lesions and superficial cyst, it is very good. Superficial in the sense which is close to the skin. Image is difficult to interpret. So a technique sensitive thing, the technician or doctor should know more about the area which is scanned. So those doctors who are well versed with parotid gland only can interpret the parotid gland with ultrasonography. Technique is operator dependent. And this is a thing that is called as ultrasonography. Very simple and easy to carry thing. Everywhere you can carry and walk because this is a computer, laptop-like thing. And this is the transducer. And the transducer, when it is applied to the body parts, it takes the image and takes through this code wire, and it is displayed in the computer monitor. Here, a close section of the transducer. Transducers may be semicircular or round shape or a flat one. Whatever it is kept near to the skin surface, very close to the skin. And the electricity which is coming to here is converted into sound waves. Such materials are called as piezoelectric materials. It accepts this electricity and converts that electricity into sound waves and sense it. And these sound waves will be taken to the body parts, and whatever sound waves reflected back will be again sensed by the same transducer, and these sound waves are again converted into electric signal and sent it to the computer. So an image may be something like this, ultrasound scanning. And here, a salivary stones. In the salivary duct, you can see an hypoechoic and hyperechoic. That is a echo, what is created by the sound waves. That is what depicted in the computer screen. Uses in dentistry. We can use ultrasonography for assessment of salivary glands, whatever sialolithiasis or sialadenitis, all these things you can find out. Soft tissue masses, that is cyst, abscess, lymph nodes, etc. You can evaluate with the ultrasonography, whether it is submandibular lymph node or the lymph node in the intraparotid or paraparotid lymph nodes, buccal lymph nodes, etc. Lesions related to muscles of mastication, you can check. Temporomandibular joint, not the hard tissue part, the soft tissue part. Disc, that to external disc, ligaments. All these things you can check with ultrasonography. Detection of vascular lesions and superficial lesions, tumors, near to the skin surface also can be checked through ultrasonography. Hope this information is very useful for you. I hope you got a small idea about what is ultrasonography. I thank you.